Hey, I am Albert. I know Victor Hugo Alarcón since we were kids, and since then we are close friends. Since Parkinson's disease has affected the ability to Victor to speak, he asked me to be the voice that helps to tell part of his story, especially their life experience and reflection on his reward system. Victor Hugo lives in Cali. He is considered a highly informed patient, not only because it is a specialist in family medicine, but also because for several years has been studying the disease. In 2005, 9 years after the diagnosis of Parkinson's disease and secondary to adverse effects of the medication, the physician group and Victor made the decision to implant a deep brain stimulation device. In June 2012, Victor experienced symptoms hitherto unknown, which caused him great anxiety. He perceived the world without grace, faded, no emotion, no time, no joy at all. This episode lasted about 6 hours, and at the end he was just fear of that happening again. Indeed, he was repeated a second time, and fear was added the confusion. However, after the third episode, Victor already had initiated the evaluation of the reality. He begins to recover notes from his diary, and was able to identify that 2 years before the first episode, he had changes in 3 areas: eating, sex life, and risk behaviors. The assessment of prior experience, episodes of symptoms that appear recently unknown, lack of sensitivity to mental health, which dominates the healthcare services, and the difficulty of Victor for verbal communication led him to explore medical literature, looking for scientific explanations and alternative forms of relief. 2 things were the key to the literature reviewed. The first, Victor understood that his episodes corresponded to anhedonia and were neither depression or apathy. Second, he found that the scientific literature suggests that Parkinson medication leading to impulse control disorders. However, as Victor Hugo did not use any medication voluntarily for Parkinson's disease, the interpretation of changes in his behavior is that compensatory mechanisms of pleasure, which can be called homeostatic, trying to recover the loss, giving greater value to hedonic experience of sex, food, gambling, and other experience with high emotional values. These compensatory mechanisms, even in patients without medication, overcompensate and cross the threshold and can lead to impulse control disorder. Victor Hugo, after understanding his own experience, to deal with anhedonia, he assumed that human biology is designed for pleasure, and both pleasure and displeasure are subject to reconsideration. Overall, the Victor's objective was to revalue his quotidian activities, filling them with hedonic value in order to shun his distorted reward system, but for various purposes such as adding meaning, encourage personal growth, and autonomy. This purposeful approach is known as eudaimonism. The eudaimonic strategy designed by Victor after systematic iterations between aside and error was composed by physical activity routine, food and diet characteristics, increasing opportunities to laugh, modifying his affective relationships, redefining his sexual life, and changing his leisure time activities. In this sense, Victor, based on his own experience, identified a set of strategies to compensation related to anticipatory and consummatory pleasure. The anticipatory pleasure is to fantasize about building and realize their dreams and utopias. Victor Hugo's story suggests that it's necessary and possible to create other access to stimulate the reward system, identifying practices and individualized strategies to balance the welfare of patients with Parkinson's disease. It is about playing with circuits of patients. Today, Victor says that anhedonia is a spoiled child that I can control. I have no fear. Moreover, informed Parkinsonian patients can do an important contribution to increase the understanding of mental health complexities on Parkinson's disease, taking into account that non-motor symptoms are important factors affecting patients' quality of life, particularly in early onset and rapid progression of subtypes of Parkinson's disease. Well, I leave you with a picture of Victor Hugo with his grandson Emiliano. He's the youngest member of the support network that enables further address the challenge of living with Parkinson's disease.